Today, I wanted to talk about what we need to look out for in 2024. And it's not anything different than what we normally do, but my goal today is to have you all look ahead and start to get your staff members to look at how things are going to operate in 2024. Because if you're feeling overwhelmed right now because you think things are a little bit out of control, this time next year, I don't want you to feel that way. I want you to take some time and start to get things under control so that you will feel comfortable next year that you did a pretty good job with keeping up with things. So number one is hiring. We know everyone needs employees, good employees. So we want you to be sure that when you bring a new hire on, that you successfully complete the hiring process. There are times when you bring someone on to hire and you get all of their paperwork and they say, oh, I have to get my TB test from this other job. Well, sometimes it doesn't happen. So just make sure you have a process so that if there's a piece of information that needs to be in that employee's file, that somehow the system is flagging you or someone is keeping a log so that that information does get into the file. I used to always tell my staff, never consider an employee file complete until everything is there. So we kept them in like a special place or on a special list so that we knew there was something that we needed to do. And I've been talking to a few agencies about training their employees on new technology. We even talked about it just a little bit in our last meeting where we talked about some of the older employees in the beginning with EVV. They left the industry because they just couldn't get the technology down. And I also told you all then, we cannot afford for people to leave the industry just because they can't use the technology. So the solution was to go to those individuals and give them whatever individual training they need so that they stay with your company. Also, as your employees age, they may not be able to have a client that's a full bed client or that needs lifting and turning, but they can do companion care or they can do clients that just need a little bit of help. So we have to be innovative with using those people where their skills fit, and definitely everything is going to be online and they need to use technology. So to me, that is a big thing that we need to concentrate on. And then we anticipating what your employee pay rates are going to be. In the last 3 years, pay rates have really skyrocketed in some areas. They've really gone up. And so we don't really know where that's going to go. I don't know how you all find out what you need to pay your employees. A lot of times they just come in and say, I want this amount of money. Well, you need to make sure that you're doing some type of an industry standard so that you know whether that rate is reasonable. They were doing that back when I was in the business. They come in and ask for some exorbitant amount of money. And you want to pay fairly because that way you want to make sure they stay with your company because you need them. But it needs to be fair. It needs to be fair for you and it needs to be fair for them. So do your research. And then in the area of clients, I know most of you don't have a lot of trouble acquiring clients right now. As far as I can see, there's lots of business out there. If people know that you have a business, they will call you for services. Now, I just want to be sure if you are on this call and you own a business, a home care agency, you must have a website. You need to put up your Facebook page. As the owner, you need to have a LinkedIn page. LinkedIn is very important. There's so much going on LinkedIn. And I do notice that a lot of healthcare entrepreneurs are not on there or they're not active. You don't have to be on there all the time, but just put up a page. You know, if your name is Jane Jones and you own ABC Home Care, that you're there. Your name is up there, the name of the company, how to get in touch with you, and a little bit about your background, because that really makes you legitimate. all of those millions of people on LinkedIn, some of them need services themselves or they have parents and they go on there and search. So I want you all to concentrate on that. It's not that hard to do. Get yourself put your photo on there. Don't just have the avatar up there. Put your photo on there and build that LinkedIn page out. And also, some of you are not that savvy with posting on Facebook or wherever you need to post. You may need to get someone to help you with your marketing because every now and then you need to post something and get connected to other companies. So that will help you with your client acquisition, which is what I'm talking about now, to be able to get more clients. And by all means, if you get clients that you know that you cannot handle, do not keep them on your roster when you know that you can't service them. That's why I'm telling you all to talk to each other and transfer those clients on to the next agency. Because when people come to home care for help, they pretty much need it right now, and they don't need another frustration with us holding a client that we can't service. And just at top of mind, make sure that your employees are keeping all client information confidential. That is still very important. And when we talk about posting on social media, do not post clients' names or anything about them. And you may want to, if you want to post something about one of your employees, good things about your employees, you may want to be sure that they know about it. If you give them an award and you want to post it, just let them know, we would like to put this on Facebook. Let them know that you're going to post that information. We just really need to respect confidentiality, especially in healthcare. And then what are your rates going to be for 2024? Are you going to raise your rates for your services? We know that if you are a Medicaid provider, there's only so much that Medicaid is going to provide, and we're hoping those are going to go up. But as far as your private clients, are you going to keep your rates the same? Are you going to increase it? When I was in the business and I increased my prices, I let my clients know 90 days in advance. Those established clients, if I was going to raise my rates in May, I would let them know in February. In February, your new rate will be such and such. And just to let them know so that they could get prepared. I never had a client leave the agency because of a price increase. Because if they're satisfied with you as the owner, the services you provide, they will pay the increased rate. And hopefully you're increasing rates because you need it for your bottom line and that it's not way out of line with everyone else's prices. But some of you that have been in business a long time, your rates may be too low and you need to look at that. And just be respectful. Write that client a letter telling them what and when their new rate is going to start so that they know that you're not just putting something to them at the last minute. And then just make sure everyone is supposed to have a complaint log in their policies and procedures so that if you have any client issues or complaints, you need to put it on that log, what it was and what the resolution was. And if you get a survey, that's one of the things they're going to look at. They'll go right to your complaint log, and you're supposed to have one, and look at those situations to see how you resolved it. They're going to come in and ask for a list of clients and choose from that, but they are also going to look at that complaint log, and that may gear them to other clients that they didn't see on your list or that they didn't choose. And so we need to be sure that we are always in compliance with all the licensure rules. We know that there's the healthcare personnel register reporting. You have a certain amount of time to report any incidents that happen with your aides, and that may be related back to your complaint log. If you put something on the complaint log and it's against an aide, you need to be sure that if it was something that needed to be reported, that it got reported within that time frame. Go to your policies and procedures and look at what those time frames are and make sure you follow it, because this one is really high on the list for deficiencies. A lot of agencies do not follow it. And then making sure that your care plans are specific enough so that the aide can follow it. Some of you may have a paper care plan, but others have the electronic visit care plan. Make sure that all the things are on there that the aide needs to be doing. And we know that if they miss a task that is on that list, there needs to be a reason that they missed it or that someone saw that that task didn't get done. There needs to be documentation. You can ask the aide to do that when they say, Mrs. Jones she didn't get her bath today. And the reason is her daughter had bathed her that morning before I got there. They need to say what the reason is. And your nurses need to be looking at deviations from the care plan to be sure there's not a trend that's related to their health or some other issue going on in the home that needs to be resolved. And then going back to the appropriate caregiver assignment, we know that the care plan is the key to the appropriate caregiver assignment. And that means that if they have more than 2 ADLs that need extensive assistance, or they have a cognitive impairment or pain, they would need an aide that is on the nurse aide registry. Those rules are specific. And most of the time, you all, when our clients come into us, they're up with the walker, moving around, they're up and able. But as time goes on, they get sick, they may catch the flu and they get weak, but they start to decline. Usually our clients don't really get better, but with age and chronic conditions, they start to decline. So sometimes you may have an aide working with them that is not on the nurse aide registry. And as the nurse goes out every 90 days and revises the care plan, you may need to change that. We talked a little bit before about how quickly you change it. I will say as quickly as you can, because it's kind of a catch-22 situation. Your aide has been there with that client. They know how to do all the tasks, even though the client has declined a little bit, but you still need to abide by your rules and regulations. So change it as quickly as you can. Make sure that you get the proper aide in there. But this is really a tough area, and it does get looked at. I will say that. The policies and procedures for the state of North Carolina were updated in 2018. So we're 5 years in. Most of you that are new agencies, you have up-to-date policies and procedures, but some of you that have been around a long time, yours may not be up to date. So just be mindful of that, because what they're expecting when they come for a survey is they look at your policies and they want you to follow your policy. But if your policies are not up to date and there's things that you should be doing that are not in your policy, you will get a citation for that, because one of the things that you need to do as a provider, a licensed provider, is keep your policies and procedures up to date. And once again, I just wanted to note that I am happy to give you all this information every month. But before you change anything in your policies and procedures or your daily activities, go to the authority, go to the rules and regulations, or if it's something related to labor or whatever, or your accountant or your attorney, go to them and be sure that you're doing the right thing before you make that change. I try to make sure that I give you a high level view of the things you need to be doing, but I don't want you to change anything before you make sure that it does definitely apply to your agency. So that's basically what I had to cover today. And I wanted to know, are there any questions about what I just covered? If so, then I'm willing to take questions. You can just open your mic and go ahead and ask whatever your question may be. Good to see you all today. Are there questions about anything other than what I talked about today? I want to just remind you all that you know that you're licensed, so you need to renew your license by the 31st of this month. So just make sure you stay on top of that. It is electronic. The way that you renew your license is an electronic process this year. So just make sure that you get that done so that after the 31st, you are not out of compliance. Next year, we may change the format a little bit with what I do once a month, but I will let you know in advance as I let you know when we're going to be here. Any other questions? All right. You all take care. Have a Merry Christmas, and I will see you all in 2024. Thank you. Bye-bye.